Being the oldest of three in my family, I always have an instinct to take care of people, starting from a really young age. My grandfather was a medic in World War II, and he used to tell me war stories about people he'll encounter in the medical field. But it wasn't until I was in my early 20s when I was introduced into the field of Neurodiagnostic and Sleep Sciences. I'm currently working at Huntington Hospital in Pasadena, California as a neurophysiologist. I've been working there in the OR for about 8 years, and I monitor neuropotentials during brain and spine surgery, and I make sure that the neurological functions of patients are unharmed during surgery. And I like to tell my patients that I get the surgeons off their nerves. UNC's program really helped me to become a better tech and a better health provider. The curriculum gave me the foundation and the knowledge for practical theories. I'm very passionate about this field, and I would like to advance my education by attending grad school. I believe continuing my education will help me advance my knowledge and expand my involvement in this field. I would like to one day be in the forefront of neurodiagnostics and sleep science, either in ways of research, development, or education. I'm extremely honored and very fortunate to be the recipient of the Temper Seeley International Scholarship. Thank you for believing in sleep science. Thank you for encouraging me to continue to study neurodiagnostic and sleep sciences.
When I moved here from Ethiopia, my goal was to get a further education. So in spite of having a radical shift in culture and education systems, I was able to finish the electro-neurodiagnostic program at Community College of Denver. Since then, I've been looking for opportunities to further my education. Currently, I'm a technical support for the Department of Neurophysiology and Sleep at Children's Hospital Colorado. My responsibility is to make sure all the equipment is properly maintained and checked in a timely manner. I am also database administrator, and therefore I manage all QA data for sleep. My work focuses on maintaining and troubleshooting of sleep machine. The UNC-CH Neurodiagnostic program I am attending helps me to understand more about sleep and the issues of sleep technicians are having. My current goal is to explore innovative use of technology for sleep and neurophysiology field, focusing on telehealth or telemedicine. The Temper Seeley International Scholarship Program enabled me to attend my education without having further financial pressure. The fund I received helped me to cover the significant amount of my educational expenses, and I would like to take this opportunity to say thank you for your generous contribution toward my education.
I'm currently the clinical manager of the neurophysiology lab and the epilepsy monitoring unit at one of the top 10 hospitals in the nation, Children's Hospital Colorado. I'm responsible for the day-to-day operations of both departments. I'm in charge of the scheduling, finance, program development, you name it, I do it. I've got a great group of techs that I work with. I've got 15 EEG techs, I've got equipment engineer, schedulers that all report to me, and I thoroughly enjoy my job. The UNC NDSS program has really done a lot for me in my development of my career, also of my department. I now have a much deeper understanding of sleep and IOM than what I had from before. So I really have enjoyed learning those things, so I have a better grasp on those departments. I look forward to using the knowledge that I've received to hopefully grow, hopefully to one day take on leadership of those two departments as well, but also just to really reach out and become the best leader I can. Long-term goals, I hope to continue to stay here at Children's Hospital Colorado. I love my job. I love to follow in the path of my director in front of me, one day taking on leadership of the sleep lab and IOM programs, and then hopefully moving on up to a director position. When I received word that I had received the Tempur-Pedic International Scholarship, I was absolutely thrilled. I was speechless. I was so honored and so thankful for what a fantastic privilege as this is to receive a scholarship for the program. I really appreciate the support that I have received from this. Like I said, no one in my family's ever been back to school, so there's never any money set aside for further education. So I've had to pay for all this out of my pocket, as well as work full time, as I'm the sole provider for my family, which is growing. So receiving the scholarship was truly a blessing. It helped me to concentrate on my studies in order to excel in the program. I am truly grateful.
are the University of North Carolina Healthcare System.
2,668.
2,668 physicians.
19,605.
19,605 coworkers.
765 medical students.
100 counties.
100 counties served.
257.
$257 million in research.
2 mascots.
9,027 births.
375,137 patients each year.
What is he doing?
145,866.
145,866 patients going into the ER.